I'm
hospice?
Dr. Neil Fergusson. I'm a retired consultant anaesthetist. I worked here at the Countess for, 32 years. And I'd been retired a couple of years before I was asked by one of the existing trustees whether I would be interested in supporting and helping the hospice. I felt that I wanted to use my skills in some way, and this was an ideal opportunity of being able to sort of marry the knowledge that I'd got of the healthcare systems and how they worked, and also help support the hospice with some oversight of their clinical work and systems. And it's worked really well. I suppose it's a question of wanting to give something back to society and the community. I've had an amazing sort of medical career that I've thoroughly enjoyed. I know I've been very privileged in the training and opportunities that I've had, and it's been enormously beneficial to me, and I would hope to the hospice as well, to be able to feel that I can give something back to society and to the community in general. I think in two ways. One is I really enjoy working with a very keen, dedicated, enthusiastic team who very much have their clients, patients at heart, and are so enthusiastic, even when you'd think that life was not dealing people the right cards. They are very supportive and very positive. And the other is for my own personal, if you like, feelings of satisfaction is feeling that I've achieved something that is really useful and important to other people. The board operates through a number of subcommittees, and the ones that I'm particularly involved with are the Clinical Governance Committee, which is, as it says, is about the quality of care of the patients. I also sit on the Care Committee, which is the committee that reports directly to the board. And slightly separately and independent of that, I sit on the Medicines Management Committee, which involves liaison with the Pharmacy Department at the Countess. And finally, the last committee that I sit on, which is sort of unrelated to my background, is the Service User Group, which is a group combined of the hospice staff and service users, both from the Living Well Centre and from the inpatient unit, so that we can get some, the hospice can get some feedback as to how things are going, and also to make sure that we get our communication appropriate for the sort of information that the service users would like to receive, and in a format that they find easily accessible. The board does try and encourage people to sit on a committee that is not their area of expertise, because sometimes they can ask what might sound the silly question, but is actually the important one. And I'm hoping to join the Income Generation Committee just to sort of partly see what's happening and get a bit more insight into the way other aspects of the hospice work. I think get in touch with the hospice and come and have a look round, just see how you feel about what happens here, and because the range of skills that are required. Mine is medical, but you need finance and legal and infrastructure support of all sorts. So there are lots of opportunities and ways one can help. Come and have a look, and then if you feel that you might be more interested, then get in touch with the board, perhaps join a board meeting as an observer, and see how things work and whether it might be the right thing for you.